Hey, welcome back. It's the two boneheads, Howard Lux and
Jeff Burke. How you doing?
again, we're bringing you 40 years of orthopedic experience, hopefully helping you make better choices and be a little better prepared for your visits with the other orthopedists out there. So today we're going to talk about a hot topic. What graft do you choose when you are thinking about an ACL reconstruction?
So, so the talk that I usually have with my patients is that the literature is a little unclear. You can't always tell. I'm not able to tell what the best graft is, but it's easier for me to tell what the worst graft is. So in the U.S., there's three main grafts. One is allograft, which is other people's tissue. People die, donate all kinds of things, and they donate tissue that we can use for ACL reconstruction. There's patellar tendon people will hear about, and then hamstring grafts. And between those three grafts, it looks like if you're an active young person, allograft is probably the worst of the three. It looks like the incidence of failures is considerably higher. It's somewhat controversial, but I think many papers seem to show that.
I think Jeff's being a little kind there. I think the allograft failure rate is significantly higher.
Significantly, 3 to 5 times higher.
Yeah, exactly. It really should not be placed in children. It shouldn't be placed in adolescents or anyone who participates in what we call class 1 activities, turning, pivoting, and twisting. Your basketball players, your soccer players, rugby, lacrosse, etc.
Yeah.
Yes? No?
No, I agree. I don't use them. I mean, I use them occasionally in a revision setting where they may not have tissue.
Agreed.
And I'll use it perhaps in older, more sedentary people who are having instability.
Agreed.
That I'm operating.
A multi-ligament. If we need to build more than one of your ligaments back, then Absolutely. It helps to use allograft.
Yeah, but I don't typically use them in primary ACL, and particularly in active young people like you described. Now, between the other two grafts, patellar tendon and hamstring, I've used both, and I think that the literature isn't quite clear that one's better than the other. I think from the standpoint of success of your reconstruction, I think, Howard, you'd probably agree that they both seem to be very similar when you look at large studies and this kind of thing. Where the problem comes in, I think, is they each have their own sort of complications or issues on the downside that you have.
Uh-oh.
Those might be.
Oh, he's back. We left Dr. Berg for a second there.
You froze up on my screen.
So the downsides of potential downsides of the patellar tendon graft, knee pain in front of your knee, very rare, but it does happen. Hamstrings could produce weakness in some people as well. So there's no perfect graft out there, but we do know, and we both agree, avoid allografts, avoid cadavers. Why do you think surgeons use cadavers? Because despite the evidence, I still see surgeons putting in cadaver grafts into young people.
Yeah, it's interesting. I think it's easier. I think it's just simpler.
Agreed.
And it takes less time. And in today's medical market, it's volume, so it takes less time. It's easier to do. There are some risks with taking the graft. I think initially people actually started because they were trying to avoid some of the complications with the graft.
Right.
And then I think, if you don't take a graft, then you're not comfortable taking a graft. And if you've been doing allograft, you just keep doing allograft. But I think the data, like you keep saying, shows that allografts in young active people is concerning. I would not have an allograft in my knee. And my daughter is 16, plays lacrosse. I would not want her to have an allograft in her knee.
I agree. I mean, the research is really clear, and every paper that comes out is showing the same thing. You still have surgeons that are out there trying to push it. I think it's because a lot of the companies are selling, pre-made grafts all ready to go. You take them out of the freezer, you thaw them up, and you put them in the knee. It takes an hour operation and makes it into a 20-minute operation. So what? you want your ACL to last you for as long as possible. You want the best chance possible at return to sports without having a second tear. Allograft is not your option if that is, in fact, your goal. And I agree. And hopefully we're going to have a lot more conversations like this with frank and honest discussions about some of the trends that are going on. I definitely agree with what you mentioned, that most docs choose this because it's faster and easier to do. But I also feel if you're not comfortable in harvesting either a hamstring graft or a patella tendon graft, and you don't know when to use either of the two options, you probably shouldn't be doing an ACL reconstruction in the first place.
Good thought.
All right, folks. Have a great day. Look for us next week. Bye.